and we are experiencing and we are walking through a new normal. It may seem that the room is emptier than it was last year, but it's quite full online. So online, these chairs are quite filled up. So I just want to say hello to everyone that's joining us online on Zoom. We're really grateful for all of you joining us. And we wish you could be here to have this wonderful breakfast, but we're enjoying it in your honor. And I'm really honored that all of you are here with us. What a great privilege it is to have our first in-person meeting for the Human Service Alliance of Greater Prince William. We're really grateful to be with all of you this morning. My name is Will Archer, and I serve as the current chair of the Alliance, and I'm super grateful for our incredible executive director, Chelsea Conaway, right here. And Chelsea's parents are here with us, which we're really honored to have them with us. They're the reasons that we get to have Chelsea, and she is absolutely fantastic. She's done an incredible job, really leading through the greatest transition many of us have seen in current history. So we're very grateful for that. So our meeting is officially called to order, and I'm honored that we get to be here and gather with all of you. I just want to introduce you to our board members. First off, from Northern Virginia Family Services, Andrea Eck. Andrea, thank you. Andrea there. And then Pastor Abby from St. Thomas. Super grateful for her. And then we have Steve Liga from Acts. Everybody knows Steve. Because, you know, Steve's just, everybody knows Steve. We're super grateful for Steve. And Steve served as the chair, so I'm getting to do what I saw Steve do 2 years ago. Not as well as Steve would have done it, but as best as I can. So,
better projection in your voice. Just more smile.
I know, I was talking to people way in the trees over there. But that's what you get with ministers, you know, that's what we do.
That's how you attract members.
There you go. Call them to the room, absolutely. And we have Janaea Monroe, who's with us online. Janaea, we're so grateful for you serving. And she's with Professionals by Design. So grateful for Miss Monroe. She's incredible. Mr. Marty Noe. Marty's with us online, I believe, as well. So Marty Noe, and everybody knows Marty Noe, of course, from Science Connection, and from a million other places. Marty's a good friend and a great board member. Super grateful for Marty. And then Steve Pierce, my good friend Steve, fellow pastor here. So grateful for Park Valley Church. That's different than Potomac Valley. They're on the west, we're on the east, but we're covering Prince William County together. So I'm super grateful for him. And he's such a great friend and a good man. And then Karen Smith. We all know Karen Smith from the ARC of Greater Prince William. Karen's with us online. Karen, super grateful for you. And then Dr. Terry Tinsley. Where's Terry? Right here. There's Terry from Beaufort, Moral. Many of us know Terry from lots of places. Super grateful for Terry. He's an amazing man. And then, of course, you've already met Chelsea. But some of you may not have met Reggie. Reggie's incredible. He's our operations manager. And in this new world of us being on two platforms, this two bi-platform world, Reggie's super important because he's managing all the rest of the room. Of course. So good job, Reggie. Make sure that everybody can hear what we're doing. And so we're super grateful for that. Our first order of business here for this in-person meeting before we go into an amazing panel and a great time of learning and engagement is our board elections. And for all of you that are online, and for all of you that are here in person, you should have received an email. If you didn't receive the email, or like me, the mirage or the barrage of emails, you may have missed this email. You can vote quite easily. If you need written instructions for this, I have a couple copies of this. You can vote either by going to pollev.com/Chelsea Conaway 768, if you can grab that so quickly, or we can hand this out to you. If you need one of these, we can hand that out to you. Or you can simply just text Chelsea Conway 768-22333, and you can vote by phone. So you can vote by phone. For all of you that are online, you should have received an email. For all of you that are here in person, if you need a written copy of that, I can just pass it around. Steve, you mind passing a couple of these around to folks that need that? Just a bit of instruction as it relates to our board elections. As per our bylaws, we actually have 4 of our current board members that are on the ballot, and we have an additional candidate that's come forward. So we have 5 candidates in total. You need to select 4 out of 5 candidates. So 4 out of 5 candidates is what you want to select. So whichever 4 you'd like to select, candidate A, B, C, D, or E, and they're all listed in alphabetical order. We'll certify the election afterwards, and we'll email out to you later on this week, early next week, the results of the election. So please feel free to go ahead and vote right now. We'll take a few minutes for voting. If you have any questions about voting, feel free just to raise those questions in the chat. We're happy to answer any questions you might have in the chat, or you can just let me know right here. And voting, of course, is for all of our Alliance board members, and we're very grateful that you would vote in this election. Any questions in the chat for voting? All right, ladies and gents, if I can just grab your attention again. Good morning, good morning. Hey y'all. Good morning. If I can grab your attention real quick, we're going to transition right now into our panelists. So we're really honored to talk about the future of grant making in the greater Prince William area. I know one of our passions here as we were forming the Alliance, I remember being in meetings with so many of our current board members and a lot of other really passionate folks who were involved in the process. And one of the things we talked about was just the importance of grant making and the importance of really fostering greater philanthropy in Prince William County. So we're really honored to have a distinguished panel that's here to be able to talk to us a little bit about grant making and really the future of grant making and really explore different ways that we can connect. For all of you that are following us on Zoom, please feel free to drop your questions in the chat. We're really grateful to have all of you. We're able to see some of you online, but we look forward to any of the questions that you have after we have some introductory remarks from our panelists. But I want to invite Chelsea Conaway just to introduce our distinguished panel that she's assembled for us.
Thank you so much. So hi everyone, good morning. We have the most amazing panelists here today. We're so glad that they took the time to come and be with us because the expertise that they have is just absolutely unmatched. And like Paul was saying, one of the things when we were doing our CARES program that we always were asked is, people were just expressing the fact that they were very uncertain about what the future was of their grants, what they should be applying for, what services they should be providing. 2020 was a year unlike any other. So just to even know where everything stands kept coming up again and again and again. And so when we were talking about what we would want to ask, if we could ask all of our grant-making friends anything, what would it be? We came up with a few questions. And these grant makers so graciously came to join us and help us to kind of figure out the landscape of what it's going to look like going forward as best as anyone can tell. And so we're so thankful. I'm going to go ahead and introduce our panel today. And so we have Dr. Vanessa Gattis, and she's president of the Prince William County Community Foundation. Hey, welcome. And we have Susie Lee, who's executive director of the Potomac Health Foundation. Welcome. And we have Dr. Leventhal, who works with Kaiser Permanente. And who you cannot see right now, but who can see us behind that pop-up bubble, is the chat bubble, is Sari Raskin. And Sari works with the Community Foundation of Northern Virginia as their executive director. So fortunate to have everybody here, virtually here in real life, taking time to be with us. And so I won't belabor the point other than to say you're in for a treat and you take good notes.
Awesome. So we are so grateful to be able to have all of you with us and to be able to have this distinguished panel. So we wanted to just start off, now that we've introduced y'all, we'd love to hear your thoughts, first off, on what are grant-making priorities, or rather specifically, what are your grant-making priorities in 2021 and in the next coming years? So we'd love to hear your thoughts, and also, Ms. Raskin, I definitely want to encourage you, if you can see me here, you can unmute, and we'd love to hear your thoughts as well. So just want to put that to the panel. So what are your priorities in 2021 and in the coming years?
Do I go first? Okay.
Absolutely, please.
Great. Chelsea, do we happen to have my slides up? Working on it. Well, good morning, everyone. I'm George Leventhal, and it took me a couple of days to get permission to attend this in-person event, and I was told that I finally could attend if I remained masked. So here I am wearing a mask. I did take it off to drink my coffee. Also, it's a great pleasure. I'm just giddy to be out of the house and wearing a suit and tie. I have had many occasions of wearing a jacket and tie without pants or shoes.
There you go.
I would not have subjected all of you to that. I've been with Kaiser Permanente for 2.5 years after 16 years as an elected member of the Montgomery County Council. I want to give a shout out to my former colleague Marty Noe, who I knew well when we were both local elected officials. I know he's in the audience. For the first 2.5 years, my line of sight was over our charitable and community health activity in Washington, D.C. and suburban Maryland. I'm still responsible for Washington, D.C. and suburban Maryland, but recently we've had some internal reorganization, so I'm very glad to be here with line of sight over our programs and partners in Northern Virginia. Very, very happy to be here. Very happy to be anywhere outside of my house, but especially happy to be here with you. And so Kaiser Permanente, of course, is a healthcare system located in 8 states and the District of Columbia. We have 12 million members nationally and just under 800,000 members here in our Mid-Atlantic region. Our philanthropic priorities are set at the national level, and I'll just talk without slides, Chelsea, just relax, it's okay. Among the philanthropic priorities that are set by our national office are charitable health coverage, food security, economic opportunity workforce development, thriving schools, social health and support for access to care, and housing for health, which is a particular specialty area. And so it is not easy to get funding from Kaiser Permanente if we are not able to describe an initiative as within one of those priority areas, what we call common areas of focus. But there are a number of partners here in the room, including Northern Virginia Family Services, including ACTS, and other partners that we've worked with, where the work on providing access to care, ensuring food security, those two in particular here in Prince William County, and working with the school system. We have extensive relationships with the Prince William Public Schools, fit very well with our philanthropic priorities. And while I have time here, I do want to especially highlight the Wellness Park at Harbor Drive in the town of Occoquan, where we have worked with Prince William County. We are a sponsor of a wellness park which is community accessible with a 1-mile walking trail connecting to the new Kaiser Permanente Medical Center at Casey Hill. So we are invested in this community. We care deeply about the health of this community. We want to get to know you and work with you, but we do have these priority areas, as I mentioned. So if you're looking for funding from us, you best couch your application in terms of one of these priority areas. I'm available to you at any time, george.l.leventhal@kp.org, and happy to, as soon as I have permission, come out and visit. I was just on with Andrea about making a visit soon to Northern Virginia Family Service, which is such an important provider in this region, and I'm just, again, I'll just close right again. I'm just giddy to be able to get out and see people, and I'm an experiential learner, so the more time I spend here in Prince William County and throughout Northern Virginia, the better I understand the human services that you're providing. My mother taught me that the meaning of life is service to others. I know that all of you share that ethic, and so we are in the people-serving business, and I'm very grateful to all of you for the help that you're providing every day to Prince William County residents.
Hi, I'm Susie from Potomac Health Foundation in Mike, Georgia. I'm really excited to be here in person as well. I think I'm a little more excited about the scrambled eggs. I forgot how good they were at 1 degree, so I'm glad I got a plate full of those. So I think a lot of you are familiar with the Potomac Health Foundation. Our strategic plan priorities for the past several years have been access to health, behavioral health, capacity building, and then for our 2021 to 2022 grant-making cycle, we added a COVID-19 response. And actually, most of our grantees for this current cycle that we just awarded were COVID-19 response grantees. And so aligned with health, not necessarily as directly related to health as we've been funding in the past. So I think in thinking about the years coming forward, I mean, we are a health foundation, we're a health foundation, and so our mission has been to improve the health of the community. we have funded health priorities and will continue to fund health priorities. I think where the shift will probably occur, in the past we've mostly funded direct services, so health safety net clinics, food access, direct services. And we are still heavily investing in that, and there's no plan to stop that. I think those direct services will always be a necessary resource that our community will need. I think where the shift might occur and has been occurring over the past couple of years is funding more in, I would say, community building and systems change as it's related to the social determinants that affect health. So these are the conditions, I think most of you are familiar with this term, but conditions that exist like where you live, where you work, where you play that affect health outcomes. And so we found ourselves funding more in that direction, realizing that we do fund a lot in the community in Eastern Prince William County and surrounding communities. We fund about $5.5 million in grants per year. That being said, that's a drop in the bucket. I mean, you can spend all of that just on economic relief or housing or the health or medical services. And so I think funders are starting to become more interested in having a bigger impact with their dollars and seeing the needle move, and we're realizing that you need to have a combination of funding direct services as well as systems change. And I think in the funder community there's still a lot of conversation about what that means, supporting community building, advocacy, policy, that type of thing. So those are our priorities. So we have our traditional kind of health priorities, and then it's a little bit more nuanced when you're thinking about how you're trying to affect those health outcomes. And I would say that generally for most human services. I mean, I think COVID's really, actually that might be the next question, so I'll just pause there. Thank you.
Hi, good morning. I'm Vanessa Gattis, President and CEO of the Prince William County Community Foundation. And thank you, Chelsea, for allowing me to be here and be a part of this panel. Just a little bit about my background. I am a Army veteran, so I spent 30 years, 9 months, 16 days in the Army. And so when I retired back in 2018, I knew that I didn't want to go into corporate America and work another 9 to 5. And so the Lord blessed me to start the foundation, so to found it and to become the president and CEO of it. And since then, our whole mission is to help improve the quality of life for the residents here in Prince William County. So one of the things that we did was to go around and talk with residents to see what the need was here in our community. And so we came up with 3 pillars, looking at grants and scholarship, health and wellness, and food security. Kind of the same thing that my fellow colleagues here are looking at as well. And so with our grants and scholarships, we wanted to focus on education. And so we provide scholarships and grants to high school seniors as well as educators. We have a micro grant program for educators throughout Prince William County, Manassas, and Manassas City. And so we try to encourage educators to apply for our grants, because we know that sometimes educators don't get the monies that they need in order to supplement what they have to provide out of their pockets for their classrooms, and so we try to help them in that area. As far as health and wellness, we know that health and wellness is a big issue for a lot of people here. And the other thing that we try to do is make sure that our residents don't go outside of Prince William County to find those services that are needed here. And oftentimes the problem is that people don't know what's here, who's here. And so through our Health and Wellness Expo that we have each year, we have one coming up in October, we bring together health and wellness experts so that they can give the resources that our community members need in order to help them have a better way of life. And so we'll have more information that'll be coming out for our Health and Wellness Expo. And then food security. I don't know if anyone's heard, but we have our Chow Wagon, Combating Hunger on Wheels. One of the things that we found out is that although Prince William County is one of the most affluent counties in the state of Virginia, we have one of the highest food insecurity rates across the state. And so one of the things that we did, or what we found out, is that transportation is an issue for a lot of our community members because they can't get to food banks or churches where they are giving out food resources. So one of the things that we do is we go into the community. We have 2 chow wagons. We try to cover the east and the west side of the counties. We take our chow wagons into the communities and we distribute food to community members. We first started focusing in on children because we know that 28,000 kids in our community are on free or reduced meals during the school year. But in the summer months, a lot of those kids go hungry because the food is not there in order for them to eat. And then we have roughly about 14,000 to 20,000 of our residents that are in that same category. And so one of the things we wanted to do was get down into the community, so we take our chow wagons into the community and we distribute meals to our residents. Since COVID started on last year, we've distributed over 150,000 meals to our community residents, and the need is significant. The pandemic only exacerbated the issue because food insecurity has always been here, but the pandemic has now just enlightened that situation. And so 2 to 3 times a week, we go into the community and we distribute food. We're grateful for the partners that we have. Prince William Food Rescue and ACTS are one of our partners. We have Prince William County Schools, who is a partner of ours, and now we have the Potomac Health Foundation, who is also a partner of ours too. And so we are excited about the things that we are doing here in the community. We try to let people know is if you need any type of assistance and we are not able to provide that, we do have the resources to get that information to our community members. And so that's why we are here. And I'm always accessible. A lot of people tell me I don't have a job because I'm retired. You know, I enjoy my retirement, but I love what I do for the foundation and helping people in our community. And so if there's ever a need, if you need anything, please don't hesitate to reach out to us. We're always looking for partners. We do have a big event that's coming up, a fundraising event for all nonprofit organizations, all not-for-profit and churches. We have what's called Prince William County Gives. So it's a fundraising event for all of these organizations. It's a 24-hour event, virtual event that we're having. And we hope that we can get quite a bit of nonprofit churches and not-for-profit organizations to sign up for this event, because we know that last year, the pandemic, a lot of organizations weren't able to raise the money that you would have normally have raised. And so this is our way of letting Prince William County know that, look, we have all of these nonprofit organizations, all of these churches who are doing great work here in our community. And I always tell people, nonprofit organizations are the backbone of this community. Without a lot of these organizations, a lot of the services that we have wouldn't exist. And so we need the support. And so this is our way of letting the community know to support nonprofit organizations and churches all across our community. And so if you need any information on that, please don't hesitate to let me know. So thank you again.
Thank you very much. Thank you very much. And Director Raskin, I know you're unmuted. We can see you, and you can see us probably in 2 different places. So yes, please.
Hello?
Hello, we can hear you great. We're okay. Can you hear us now?
I can hear you.
Okay, we can hear you. We look forward to everything you have to share. So please tell us a little bit about your grant-making priorities in 2021 and the coming years.
Sure. Hi everyone, and thank you so much for giving me the opportunity to be here through this hybrid model. It's very exciting. I'm Sari Raskin. I'm from the Community Foundation for Northern Virginia, and I'm the VP of Grants and Community Leadership here. And we're very excited to be able to partner with the other grant makers that are here on this panel. And it's great. I've had many partnerships actually with Kaiser and also the Potomac Health Foundation. I look forward to getting to know the Prince William Community Foundation as well. And our priorities, 2020 was, of course, like everyone else, a very challenging year, but we were able to make an impact through our COVID-19 response fund. We gave over close to $2.5 million out very, very quickly throughout Northern Virginia. But what I would also say is that we were very fortunate to be able to support many organizations, I think, that are represented here through our COVID-19 response fund, and then also through our general grant making that we traditionally do annually. And I'm happy to say, and I hope that this will continue, that we were able to make a large impact over the past year, and we hope to do that moving forward. Our priorities are really centered around meeting basic needs. That has been kind of our discretionary grant making focus has been that for many years, and it's continuing to grow, thankfully, both in Prince William specifically. We have a couple of donors that are specifically focused on Prince William, which is great, and then also throughout our region. And even though organizations may be located, of course, in other areas around the region, but they are servicing Prince William as well. So basically, our priorities are to continue to meet basic needs through our Community Investment Fund, which many of you are familiar with, which meets needs varying from, we have a poverty relief fund that's really around housing and eviction prevention, and then also summer and after school programs. We have a military personnel and their families fund. We have an aging fund that helps individuals with age in place. We have a mental health fund that we are hopefully going to continue to be able to have in the coming year as well. That was a really, we had a donor that came forward and recognized the importance of that and helped us really make an impact this year. We're hoping that that will continue. And we have also a child youth fund, I think I mentioned that, and an education fund, I'm sorry, that's also focused around early childhood, and then a job training and workforce skills. So that's our basic needs. And then we also have an arts fund that we ran a successful grant process for this past year, and an environment fund, both of which are continuing to grow, and we hope to be able to fund both arts organizations that are focused on arts education, mostly for those who are underserved actually, and then also our environment fund will continue to grow, we're hoping, and be able to fund organizations, again, that are focused on education, mostly for underserved. So that's our general priorities. We also were very fortunate over the past year to fund our Build Back Green Forward Fund, which is our continuation of our COVID-19 response fund. We were able to fund community conversations, many of which are actually happened at Prince William, which we're very excited about, and we'll be reporting on that over the next few months. And we were also, we were funding leadership organizations. Leadership Prince William was funded, and also volunteer organizations, including Volunteer Prince William. And also we were able to fund through Build Back Green Forward other organizations that we will, again, we'll be reporting on. But that was a great opportunity, and oftentimes we have additional funding that's available. If you are not already on our distribution list, please feel free to email me. We'll make sure you are communicated with about all of our opportunities. We will always be, again, as I mentioned, the Community Investment Fund, always having that fund, and the process for that will begin in January of 2022. And then we also have, finally, an innovation fund that is not a discretionary grant process, but I'm interested in learning about innovative opportunities in our region. And so if you want to connect with me or any of our staff, we're always here to talk through ideas and tell you more about our priorities and what we're doing, and hear about your organizations and potentially even help you think through opportunities for funding through us or others as well. So again, thank you so much for having me today. I really appreciate it, and I appreciate your flexibility in allowing me to do this virtually as well.
Awesome. That was incredible. And you know, it's always been our dream here with the Alliance that we would be bridge builders. And Chelsea, thank you so much for assembling this really distinguished panel and everything that y'all have shared. We've got one or two other questions, but I want to encourage you, if you have some questions, either on the chat or if you have any questions just here in our gathering, for the panel. That's the joy of having a panel. Feel free just to let us know, and we'll make sure we pass the mic around so you can ask those questions. Wow, that's a lot of stuff. Thankfully, you can go to the Alliance website and be able to connect with a lot of these folks. And also, because you're part of this wonderful breakfast, we can send you the contact information and all the information that we've all just heard. If you're anything like me, that was like, wow. And that was really, really, really incredible. All right, quick question for our panel, and this was another question that was posed. What do you want nonprofits? What do you want nonprofits, faith-based and government human service providers to know about accessing resources in today's climate? What, if you were to distill it down and say, what do you really want us to know? What would that be?
Well, I do think relationships are very important. I will say that Kaiser Permanente is a very hands-on grant. We very rarely respond to unsolicited appeals. Having said that, we also recognize that relationships may be inequitable, and that there may be advantages of white privileges and networking and that sort of thing. And so we also have a very, very strong racial equity focus. We have a strong emphasis on supporting nonprofits that are led by people of color. We are working to assist small businesses and organizations and institutions that are led by historically disadvantaged groups. And so, so I would say those are the two pillars. Number one, it's important that we know you and that we know the work that you're doing. It's not likely that if we don't know you, if we haven't identified your work as something that is consistent with one of the national priorities I mentioned earlier, it's not likely you're going to get funded. But also, we have a heavy emphasis on equity, economic as well as demographic equity, and so the majority of our philanthropic funding in the DMV does, of course, go to areas of highest need, communities with the deepest poverty and lack of access to resources, food insecurity, homelessness, these sorts of things. So we are very focused on equity. So you're going to want to make your case on those two bases, that your work is consistent with our priorities and that your focus is on those who need the most help and who have historically been locked down.
Yeah, I'll just echo and add on to what George said. I think funders are thinking a lot about equity, and I mentioned systems change. I think funders have been thinking about equity and racial justice prior to the pandemic, and I think the pandemic, as Vanessa mentioned, really brought to clarity things that you all as human services providers have known for years. I mean, the differences in life expectancy and health outcomes for people of color, and so I think if you are a direct service provider, I think a funder would want you to think of why does your consumer base look the way it does, and what are the historical and structural things that brought it to this way? Why are there health disparities? I think it's very important to be educated and up on those issues, and this is a reality. If you don't like it, too bad. I mean, a lot of funders are moving in this direction. You have to get on board. I don't think there's any sort of gray area in this. So I think that this is, something that has been deep-seated for many years, and I think the pandemic has really brought it to light. And, I think it's in some ways, the pandemic, these are sort of the silver linings that have come out. Like we're having a reckoning about this in human services community, in the health community, in public health, in the funder community. So I think we all need to be aware and educated on those issues. So that's what I would really, if I had one message to give to the providers, to know about accessing resources in today's climate. We're a part of a lot of different funders group, the Washington Regional Association of Grantmakers in Health, Exponent Philanthropy, Keep Grantmaking, and equity is it's just been at the top of every single agenda. So if you're trying to access resources, it's important for all of us to get on top of these issues.
Absolutely.
And also I would add to that, because definitely my colleagues have laid it out there, but what makes your organization or your cause different than anyone else? Why should grantors give to your organization? So it's a matter of what makes you stand out from everyone else. What service are you providing that others may not need, and be able to expound on that, because that's what they're looking for.
Absolutely. And Director Raskin, I know that you also had something online. Thank you so much. You can unmute, and we'd love to hear your thoughts.
So I would agree 100% with all that is said. I agree very much with the idea of identifying a way to differentiate yourself, and also demonstrating that you're collaborating with others within the community. I think that we get many grant applications all the time, and we know that everyone's doing great work. And I also wanted to mention quickly that we'll continue to fund unrestricted funds, so very flexible funding intentionally. And we're also very conscious of the fact that you, as the nonprofit, are on the ground doing your hard work, and that writing grants is unfortunately one of the last priorities, because you're trying to really meet people's needs. So we're trying to be responsive as a funder, actually, from that perspective, to make it as easy as possible to apply for funding. But know that yes, the ability to differentiate yourself from others is key, and also to demonstrate to us that you're working within community with others is helpful as well.
That's outstanding. That's outstanding. And then let me pose another question here that has been submitted to the panel. Are there how, if at all, has your grant making changed in the context of the last year? So in light of the last year, how do you, and I know you've kind of answered some of that in some of what you said, but if you were to distill it down, if you looked at how you did business in 19 compared to how you're doing business now in 2021 in light of the pandemic, how's that changed?
Well, you've got to talk about 19 and then 20 and then 21. So in 19, I was out in the field a lot. I was building relationships. My focus was on the District of Columbia, Montgomery County, and Prince George's County. Most days I was on the road doing site visits, most days of the week. And we were focused, my particular focus was on affordable housing and homelessness, but I also made many visits in the area of food security, access to healthcare, and others. Then came 2020, and we had to stay home. And we got a lot of money from our national company. We made a total of $2.4 million in grants to homeless service providers throughout the region. Much of that was targeted towards COVID relief. And we were very heavily directed by our national office. The national office would, and this remains true in 2021. There was a call from the White House recently to our national president, Greg Adams, and all of a sudden $1 million came to our region for vaccination. So we're very responsive to the priorities of our national office, but now we are in a different scenario. I'm able to appear here with you for the first, this is as I mentioned, that's my first public appearance. I feel like Stephen Colbert,
Wearing a suit's fun.
Yeah, I'm probably talking too much because it's
no, this is great. I get it.
But so I think the story of 2021 is yet to be written. I think there's still enormous needs, great need to support vaccination effort, obviously, but we're also re-engaging in the range of issues, supporting behavioral health in schools, working on food security. I agree with my colleagues that the stark disparities in access to services were highlighted by the pandemic, but now we're able to address needs other than just the COVID equipment, COVID isolation, COVID support, COVID care, COVID vaccination. We're able again to begin engaging on a broader range of issues.
Yeah, so our grant making definitely changed with the pandemic, and I wouldn't say that it wasn't things that we weren't already thinking of. I think it just made it quicker, like it made it happen quicker. So one of the first things we did when the pandemic hit was just communicate and notify our grantees, like, look, we know that things are different now and you're not able to get out there and do your programs. You will not be penalized, or if you're not meeting your program deliverables, you're obviously not going to be able to see the people you've been seeing or serving the numbers that you said you would in your grant agreement. So the first thing we did was just email and everyone say, like, look, don't worry about it. Because I actually have heard from other grantees, like, we're so glad you sent that message, because other funders have told us that they're just not funding anything anymore. weren't. And so I think there was like a varying response to the pandemic. But that was the first thing that we did. And then I pulled together our executive committee on our board, and they understood the gravity of the situation. We ended up converting all of our grants to general operating support grants. It was like, look, whatever funds you have for the rest of the year, use the money the way you need to use it, because we know that things are just so different right now, and you need the money for whatever you need it. And so that's what we did. And so, but what it also did was precipitate our move to start funding multi-year grants and general operating support grants and program support grants for partners we've been in partnership with a long time. So several of you in the audience know that this is the first year that we did, that we offered multi-year support. And so, I mean, it's actually this is a huge, I think it's huge on the part of our board of directors to approve this. Several organizations got 3-year grants just for general operating support, big lump sums. We've been working, and this doesn't come out of nowhere. This is a long, we've been funding many of you for almost 10 years now, and we've had these relationships in place. It only made sense to do that because we know that your missions are aligned with our mission, and so, and it was, instead of having to apply every year for a new program and kind of trying to adjust, we know that you're doing the work, and so I think the pandemic precipitated that, it made it go faster. It was something we've been thinking about, but I think it really, again, another silver lining for the community organizations. And then, we did do a COVID-19 response funding as well. I think we put out, it was either $360,000 or $370,000 within the first month, just, again, general operating support to some of our partners that we knew were doing direct services and sort of needed emergency support. We also contributed to Community Foundation for Northern Virginia, to the fund that Sari had mentioned around COVID-19 response. So that collaboration piece, I think, among the funders is important as well too, because we knew that they were funding. We knew the Community Foundation could get that money out much quicker than we could. They had the application process in place, and they had, they're used to doing this kind of disaster response and relief. We are just not equipped to do that, and so our board made the decision to fund the Community Foundation because we knew that they would do it better. So I think that whole collaboration piece and working together is not just for providers, but also in the funder community as well.
Absolutely, and right before there some more thoughts are shared, it was so evident last year. I just want to say, for those of us that were serving in nonprofits, just the spirit of collaboration. I think everybody really chipped in together, and I definitely saw that just as someone serving in the community and also as a faith leader, just seeing that spirit of collaboration has been amazing. I also want to let everyone know that's joining us on Facebook and on Zoom, Chelsea's your person. You want to send Chelsea an email so that you can connect with all these folks. Our goal as the Alliance is to connect all the nonprofits and faith-based organizations and business folks that are really interested in engaging in the community to each other. And so this panel is amazing, and I know that you probably have a ton of questions, and if you're anything like me, your questions come after you leave the meeting. You're like, I had that question. You can email these folks. We're all in this together, and I think it's so powerful that we get to collaborate. Any other thoughts?
So I was just going to say, definitely our goal was to get out and build relationships with a lot of organizations. Of course, we're not as big as my other colleagues here, but it's important that we get out and that people know who we are as a foundation. And it's great when I can go into a room and say, yeah, we've heard about the Prince William County Community Foundation. And so relationship building was our biggest investment last year during the pandemic. We were able to institute, again, our micro grant program so that we could get more money out to those in our community. But I can't emphasize enough what my colleagues have said is build those relationships with these different organizations, because a lot of the decisions that are being made is based off of relationship, because if they don't know you, then they can't really advocate for you to get a grant from those organizations. And so build relationships.
Absolutely. Director Raskin also has a comment here.
So I would just say, and the rapid response funding process that we went through, that Susie mentioned, was really very short term, 6 weeks, getting money out the door, and I think it was really very meaningful, but I think also we understood the need, and we convened, we had a process that Susie mentioned in place, and so it was really a very smooth transition into rapid response funding that will be a model for us, honestly, for the future when another unfortunate crisis arises. So I think that was something that really changed some of our best practices, but also added another opportunity for us to build some work into our organization. And we were also able to fund for the first time racial justice organization, so community organizing, grassroots advocacy organizations that we had not in the past. So that was really, again, building relationships with organizations that we had not had a relationship with, really, or very strongly, and knowing that we want to continue to do that work, hopefully, as long as funding is available. And finally, we've entered into this economic equity space as well, and we were able to fund Eureka, which is an entity that's providing support for businesses in Northern Virginia, many of which are in Prince William, actually. So we recognize that it's also an economic development story here. We're here to really help the business community as well, if we can. So we not only funded Eureka, which is an organization, again, that provides support and tools and resources to small businesses in various communities, but we also funded chambers of commerce around the region, recognizing that there's going to be recovery that happens after COVID-19 as well within the business community, and that of course impacts all of you as well, all of us, and all the residents that live in this region. So those are some things that unfortunately COVID was, as we all know, a horrible occurrence, but it also created opportunities for us to build additional relationships and additional opportunities to have an impact.
Absolutely, absolutely. And now there are lots of questions about upcoming funding opportunities and events and resources that I know a number of our members have. Again, Chelsea's your person. So I just want to encourage you, feel free to connect with us. Look out for an email with the contact information for the different organizations that we have represented here. As we bring a close to our panel, I just want to put it to our panel here to see if you have any final thoughts that you'd like to share with us as we're gonna wrap up our time. And I do want to let you know, if you'd like to stay here and enjoy the rest of your breakfast, or the beauty of the golf course, or just the joy of wearing a suit again, you're welcome. You're welcome to stick around here until 11 o'clock. But we're going to wrap up in about 5 minutes. But any final words from our panel?
I just want to thank you for inviting me. Look forward to getting to know this geography better, and look forward to interacting with all of you. And don't hesitate to contact me to let me know about your programs, and when I have permission from my company to invite me out further. Absolutely.
So really quick, I just want to, even if you're not one of our grantees, we fund a number of capacity building resources that you can access. So I'll just name them. The Funding Information Network at Prince William Library. We've been supporting that for many years, so if you need to find a funding directory, please go use that. We fund Catch a Fire, which is a volunteer-based service where you can request volunteer services for anything, any different projects, annual reports. If you need annual report, if you need website design, if you need strategic planning, translation, I mean, they do anything and everything. It's free. It's not free because we pay for it, but if you want to access that and become a member, we open that to non-grantees, so please contact me. We fund a scholarship program for Leadership Prince William for people of color, which is a direct outcome of a racism and health equity learning series we did several years ago, so that's also another resource. We're funding a community of practice on racial justice and health equity. If you're interested in participating in that, let me know. So these are all things that even if you're not a direct recipient of funds, you can access, so please contact me. And we're also doing an initiative on health and housing in Prince William County. And then our funding cycle just wrapped up, but we will open up again at the beginning of 2022, so stay tuned. Thank you, and thank you again.
And I want to thank you for inviting the Prince William County Community Foundation. And again, if anyone needs any information for our Prince William County Gives Day, which is our 24-hour fundraising event that's coming up on September the 9th. I do have some information. We would love for you to participate. Online giving last year was up over $5 billion, right? The City of Alexandria had one of these events a few months ago, and they were able to raise over $5 million for nonprofit organizations in their area. And so this is the first time that an event like this is coming to Prince William County, and we are happy to be the sponsors of this event. And so we're trying to tap into that so that we can get monies to our nonprofit organizations. And so if you're interested in that, please, I have some information for you to participate in our event.
Director Raskin, any final thoughts from you?
Finally, I just want to say, first of all, it's been a pleasure to be here with all of you and my fellow funders. And I also wanted to mention that all of the information about our grant making and our events, and also we have a new research and data center called Insight Region, which actually just released a report yesterday. I'm happy to send it to you around minority businesses in our region. We had a great event yesterday. Also, I can send you the recording of that as well, and that focused on that Eureka program that I just mentioned earlier. All of that information is on our website, and also Insight Region is going to be providing additional briefs and reports, so stay tuned for information around the data or throughout the region, and all of you will be very helpful for that as well as we continue to learn more about our community and figure out how to continue to have an impact based on data. So thank you so much for everything.
So thank you so much, everyone, and let's give our panelists a round of wonderful information that was shared, and of course we are going to follow up and share the other resources that were referenced and mentioned. Before we come to close, I did want to, well, I'm going to give it back to Laura to close this out formally, but I did want to alert you all to this little yellow box on the back of your program. It has a bunch of different Alliance upcoming events that you should know about. We would love to see you. Now, these are pretty much all virtual, but we'll be seeing you again in real life very soon. But the ones that we have scheduled for right now, you can join us over Zoom, and you can go to our website to register, and we'll also be sending this information out to you. So thank you so much.
I just want to say, as we wrap up our time together, last year was truly a transformative year, and Chelsea and her team did an incredible job working with 26 different organizations to distribute over $3 million worth of CARES funds. And that was our team's first foray in the work that y'all do, and that is no joke. So thank you for what you do. Thank you for the organizations that were part of that cohort. We're really thankful just for how everyone's really come together. For everyone that's online, for everyone that's in person, it truly is an honor to be back in person. I really appreciate George sharing how exciting it is to wear a suit. Just so you know, as a pastor, I've done the same thing. I've had my shirt and tie and my shorts and flip-flops. And so it's good to wear a full suit again. It's good to be out. It's good to be around people. Please forgive me. I come from a hugging church. If I try to reach for a hug, you can fist bump or pound. I'm really good. It's this weird, awkward thing that we're all experiencing. But we're really honored to be able to meet with you. And we'll have, as Chelsea said, lots of other digital events, many more in-person events that we look forward to in the future. All this information we'll make sure we blast out to you. Chelsea and her team will make sure that we blast out to you. Also, we'll let you know the results of the elections. Thank you so much for all of our members for voting. And it has truly been a wonderful, wonderful breakfast. And our meeting is officially adjourned, but you are welcome to enjoy the rest of your day or a wonderful day here at All Here. Thank you so very much.
our personal event.
Mm-hmm.
Are you still taping?
Yep, but I'm about to stop taping. Thanks everybody for joining us.